It's a pleasure to actually present one of the research work that we have conducted at Grand Valley State University. And I am Kamrul Hasan, but the major works are done by my students, Ken Muchira, Hemalatha, and John Moses. I wish they would have also joined this presentation, but I will try to actually present their work as depth as possible, but feel free to stop me if you have any questions. So this project is all about data mining and knowledge discovery from some of the hugely affected malaria regions in Africa. Yeah. So I have set up an outline for this presentation. So first, I will give a little bit information about the background and introduction. And then I will go through like some of the available malaria data sources. Then I'll jump into the data mining process, key observations, then relations to investments, and different diagnosis methods practiced in those regions. And I will conclude with discussion and some future work. So in background, as I mentioned that at Grand Valley State University, we have a data mining and knowledge discovery course, especially designed for the master's or graduate students. And we have like some projects that the students do to gain some hands-on experience in data science and data mining. So this group particularly is moved by sufferings of the poor, especially the young children in Africa, by different diseases. So they wanted to actually pursue one research, especially on the prevalence of malaria in Africa. And they wanted to learn like what are the associations with different factors, such as investments and different diagnosis methods practiced in these regions. In terms of a little bit background about malaria itself, malaria is actually almost absolute in the developed world, but it's still prevalent in areas like most of the central and sub-Saharan region in Africa and some parts of the Asian region. So as you can see in this graph, so this is actually a snapshot from one of the project that is available online, what we call Malaria Atlas project. But you can clearly see that the green regions are still heavily affected by this disease, So in summary, malaria is an infectious disease transmitted to humans through the bites of female Anthrapolis mosquitoes. WHO reported almost around 241 million malaria cases in 2022 and 0.63 million malaria-related deaths. So you can see that the impact is huge still now. Young children, elderly people, and pregnant women are the most severely affected groups. And as I mentioned, that Central Africa and Sub-Saharan regions are still the heavily affected by this deadly disease. So the research aimed the following objectives: investigate malaria infections and associated death trends in Africa for the period 2002-2022, because we had the data available for that period, as I will show in the next slides. Assess the impact of malaria on different age groups. Examine the association between finances, especially the investment by the region as a whole, and we'll see like how the region was investing in terms of different disease controls. And also, we will evaluate the effectiveness of different malaria diagnosis methods practiced in those regions. And if there is any association between those diagnosis methods and the prevalence of malaria. So these are the 4 points that we focused on this research. So next, I will go through like some of the available malaria data sources and the source of our data for this particular project. So as we will be focusing on the African region as a whole, and we will also be zooming in some of the heavily affected countries. So we went through some of the local information system, or maybe like the data collection procedures adopted by certain countries. And in the paper, we have thoroughly investigated how those, because at the end of the day, the data will come from the lower level. That means that how the local authorities are actually collecting the data and how they are facilitating for the clients like us and globally, So we investigated the Kenya Health Information System and then the Uganda Malaria Survival Program system that they practice. And what we actually concluded that the Kenyan health system looks to be much more thorough and complete than the Uganda health system, and actually that translates into the prevalence and the affecting severity in those regions that we'll see in the coming slides. In terms of global data sources, some of the international organizations like the World Health Organization, the Pan American Health Organization, and UNICEF. These are some of the providers of the global malaria-related data. So in the paper, we have actually compiled all the sources for researchers like us. So if you go to table 1, you will find that where these data sources are available and how we actually use this data for this particular research. So there are certain references were given like World Health Organization and then the Malaria Atlas project. So we can go and download or maybe get our data from those sources. Okay, next we'll move to the data mining process and some exploratory data analysis that we did on the malaria data. And as the title actually translates that our goal was to actually investigate different data sources for a more like fact searching process or insight search process. So we used malaria infection data and malaria mortality data and diagnosis data. So these are coming from the WHO data sources, and the investment and the GDP data, that is the financial data, they are coming from mainly the World Bank and the WHO sites. So some of the key observations. Here in this graph, we are showing the number of infections, malaria infections in African region for the period 2000 to 2022. And we can see that around 2022, almost over 35% of the population were infected by this disease. So this actually explains the severity level that was almost 20 years back. But the good news is that this has been reduced to almost around 20%. So this is a twofold reduction in the 20 years, so which is a good news for us. And in terms of mortality rate, Okay. So, but what astonishing is that because we see the reduction trend actually came to be very flat from 2015. So this actually is a kind of indication that we are kind of stalled in terms of reducing malaria in those regions. So in terms of mortality rate, the reduction is for this particular period was from 0.15% to 0.05%. So this is a threefold reduction. But just like the infection rate, we also see a kind of static trend from 2015. So this is one of the findings that we had. So if we look at the same data on the country level, so you can see that countries like Burkina Faso had almost half of the population infected by this deadly disease. Other countries like Benin, Ivory Coast, Uganda, and Nigeria, they had this rate around 40%. So we can see that how severely those countries are affected. So those were the findings in terms of number of infections and the death rates for the African region as a whole. But we wanted to actually learn some of the severely affected countries. So we zoomed in some specific countries and we took 4 samples, Nigeria, Kenya, Uganda, and Burkina Faso, to see that how their progress has been over this period. So we can see that countries like Burkina Faso, Nigeria, and Uganda, they are reducing the number of infections over the period, but this has been slow and gradual. But when you compare with Kenya, we see a very good reduction rate. So maybe the practices, the health system is working for Kenya, but not for the other countries. Same applies to the fertility rate. So we kind of see similar trend also how people are getting dead by this disease for those 4 countries. Okay. So as I mentioned in the beginning that the young children and the elderly people and the pregnant women are the most severely affected group. And when you look at Africa as a whole, we see that among the people that got dead by this deadly disease, almost 80% were the young kids, okay, under the age of 5, okay. When you look at the 4 countries, sample countries that we took for further investigation, we only find that the Kenya was having the rate around 70%, but the others were around 75 to 85%. So these also another findings findings of this research. Okay, so comparatively, Kenyan health system was doing better than the other 3. Okay, so the next couple of slides, we'll be learning about the investments and if there is any association to these the death rate and the infection rate. Okay. So in summary, we have seen a very good financial GDP growth in Africa. And so the first graph is showing like how the different countries did in terms of GDP growth. So you can see that countries like Nigeria and South Africa and Algeria, they have like a very good GDP growth compared to other countries. But when we plot the amount of investment in terms of healthcare system, we find a proportion of the GDP. We find the graphs has been quite bumpy, So you can see that it was too little in the years 2002 to 2021, but there has been increase, but also there has been some bumps. So you can see that in years like 2015, 2016, there is a good fair amount of investment, but after 2015, it got reduced in the whole African region. If we compare against the global investment, we see that in 2022, the investment was 5.5% versus 8.5%. The 8.5% is from the global average. So you see that it's always been less than 5.5% or less than 6%, but that's not consistent. So this is another finding of this research. When you look at the country-wise investment, we found that Burkina Faso is steadily increasing the investment rate, but the other countries, I think the investment also is bumpy, and we can see that for some reason they are actually reducing, they're cutting out of their financial investment in the healthcare sector. So this is one of the things that is actually affecting severely their healthcare system. Oh, okay, and the final part is all about the diagnosis methods. So this is a very interesting finding because in malaria cases, there are two major diagnosis methods practiced worldwide. One is the microscopy method, and the other microscopy meaning the thorough lab test, and the other one is rapid diagnostic test. So this graph is showing the proportion of the test that is practiced in Africa, and the y-axis actually is the year. So if I move from 2010 to 2022 in the y-axis level, we see that somehow the region is actually investing, I think, translating from microscopy test, more formal microscopy test to the RDT test. So this explains that because of their healthcare card, they are actually shifting away from a microscopy test to the RDT tests. More interestingly, if we look at the 4-country level, we found that, so this is for the Burkina Faso. So you can see that I think almost they removed the microscopy test with the RDT test. To note that RDT tests are actually cheap, and for you can imagine that that will be less effective in the same because those are not formal tests, but the region has been shifted away from more thorough tests to the cheaper and less effective tests. So that is affecting the progression of the malaria control. So let's move to the last part of the presentation. So here we have like some of our findings. So in the last 20 years, the African continent managed to reduce malaria infection rate and associated death rates almost in 2 and 3 folds, respectively. The continent has experienced tremendous economic growth over the last few years. However, this didn't translate well into the proportional investment in the healthcare sector. The overall investment in the healthcare sector in Africa is insufficient and is far below the global investment average. As reported by WHO, these numbers are, as I mentioned, 5.6 versus 8.5 in 2022. Sorry, there is a mistake here, and 5.1% versus 9.8% in 2019. Malaria disproportionately affects vulnerable populations, particularly young children, pregnant women, and other living in the poverty and remote areas where access to healthcare facilities is constrained. Microscopy is one of the more accurate, clinically practiced, and widely accepted malaria diagnosis methods. Some African countries nowadays are mainly relying on cheaper and less effective RDT tests to cope up with their constrained healthcare budget. This may have impacted malaria outbreaks and associated death rates negatively. So in terms of future work, because we are actually building a comprehensive and integrated data pipeline to periodically track the progress of malaria from multiple heterogeneous sources, as explained in this presentation. Study some other features such as weather and geospatial location configuration to learn further associative factors related to malaria outbreaks. And last but not the least, extend the research area to other parts of the world, especially some similarly affected areas in Asia and Latin America. So in conclusion, this research provided a comprehensive study of the latest patterns and trends associated with malaria infections and associated deaths in Africa. It also disentangled some concrete associations with finances, investments, and malaria diagnosis methods adopted and practiced in the region. The project's multifaceted approach contributed to a more subtle understanding of the malaria landscape, aiding in informed decision-making and public health interventions. So that was the target of this research. Okay. So here I want to stop. Thank you all for hearing us, and let us know if you have any questions. Okay. Thank you so much.